All right, for cranial nerve 1, olfactory, I'll be testing your smell, so I'll smell that. For cranial nerve 2, I'll be testing her vision. Can you read her shirt over there?
Houston.
For cranial nerves 3, 4, and 6, I will be using my phone for the flashlight, and then also the Pearl H pattern right here, and then I'll go right here, follow my finger, just using your eyes, not your head. Okay. And then for cranial nerve 5, I will have her clench her teeth, any facial sensations, anything like that. For cranial nerve 7, I'll have her smile real big. Yep. For cranial nerve 8, I'll test her hearing, so I'll have her close her eyes. All my snaps. Very good. For cranial nerve 9 and 10, I will have her swallow, then say ah. And then for cranial nerve 11, I'll have her shrug her shoulders. And then cranial nerve 12, I'll have her stick out her tongue. All right, I had a patient who came in with numbness in the arm and is falling asleep, so we're going to check their durotones and myotones. So with their durotones, we're going to start with this. It's going to be up here. It's going to be C4 and then C5. Your arms go like this. Then we're going to do C6, 7, 8, and then T1. So now we're going to do our myotones. So we're going to test the strength of those. So starting up here, I'm going to have you shrug. All right. And then I'm going to have you do some chicken wings. Oh, that was C4. Now we're doing C5. C5, push down. C6, we're going to have them push your arms like this, and I'm trying to pull you out. And then C7, I'm going to push them in. C8, I'm going to have you pull my finger. All right, let me pull you out. And then T1, fingers crossed, and then on both sides, and I will push in. Hi, I just wanted to give you a call back about your concerns with the sharp pain in your pelvis. So based on what you're describing, I'm concerned that you could have possibly kidney stones. The sharp pain that comes and goes along with the nausea and seeing the pink coloring in your urine. That happens when the stone is moving through like your urinary tract. I wanted you to stop any physical activity right now and make sure that you're staying hydrated with a bunch of fluids because there's blood in your urine and significant pain. I recommend that you get evaluated. So I want you I'm gonna refer you to someone just to get that checked out to make sure there's not anything that's super serious. If the pain gets worse, and you get like a fever and start vomiting and you can't keep any fluids down, I want you to go straight to urgent care or any emergency medical center. And then, yeah, so.
Ow.
Are you okay?
No, I got hit in the groin with the helmet and I'm feeling about to throw up.
Okay, well, let's get you off the field.
Okay.
I'm gonna have you step into the bathroom, and I want you to tell me if there's any swelling, any discoloration, anything. Let me know. You know your body, so let me know.
Of course.
All right, is everything okay?
Yeah, everything seems normal down there. It just hurts still.
Okay, well, let's take like a good 10-15 minute break, and then we'll check back in and make sure you're good, and then we'll go from there.
Appreciate it.
All right, so I know that you're coming to me with some burning and itching sensations. When did this pain start?
Like 2 weeks ago.
Okay, are you sexually active right now?
Yeah, my boyfriend, he's 17. He's on football too.
Okay, period. So this happened, when was the last time that y'all had sex?
Well, 2 weeks ago, because of that burning and itching, I didn't feel comfortable.
Okay, do you have like any discharge? Does it hurt when you pee, anything like that?
Yeah, and it's kind of yellow.
Okay. Does it itch more like on the inside or like the outside of it?
Inside.
On the inside. Okay. What's like your discomfort from like 1 to 10? From
I would say 8.
like an 8? Okay.
Yeah.
Do you have like any blood like in your urine or anything?
Not that I've noticed.
Okay. And then any odor? Or
Yeah.
anything? Okay. Have you experienced anything like this before or anything?
No, this is my first time.
Okay. All right. So with that, I'm definitely. Have you talked to your parents about this at all?
No, you're the first one I'm talking to.
So are you on birth control?
Yeah, I'm on the pill.
Okay, you're on the pill. Do you use any other forms of birth control or just the pill? Like any condoms?
No, just the pill.
Just the pill? Okay. So with that, since you haven't talked to your mom, I'll definitely suggest that we talk to your parents about it. I can do that with you. We can make that phone call home if you feel more comfortable with that, or talk to your parents by yourself. But I definitely think that you should go get referred out and just do some additional testings to make sure that you're okay and that there's nothing wrong, and so you can get any type of other medication that I can give to you.
Perfect.
All right, perfect.